If you've been dealing with stomach issues that just won't go away, burning, bloating, nausea, maybe even unexplained weight loss, there's a good chance you've come across the name H. pylori. So let me break it down for you. H. pylori, short for Helicobacter pylori, is a type of bacteria that lives in the stomach. And it's not rare. In fact, it's estimated that more than half the world's population has it. But here's the catch. Most people don't even know they're infected. Now, how does someone actually get H. pylori? The primary mode of transmission is fecal-oral. Yuck. This involves ingesting the bacteria when fecal matter contaminates hands, food, or water, which is then swallowed. This is especially common in areas with poor sanitation. Additionally, but less likely, it can spread through oral routes, such as sharing utensils or through saliva, particularly within families. In developing countries, factors like untreated water, crowded conditions, and poor hygiene contribute to higher Helicobacter pylori prevalence. Most people become infected during childhood, usually within the first decade of life. Infection rates are higher among children in developing countries due to these environmental factors. For example, in South America, the prevalence of H. pylori infection can exceed 70% of the population, whereas in the United States, the prevalence is estimated at around 30% to 40%. Once it's in your stomach, this little spiral-shaped bacterium starts causing trouble. It weakens the protective lining of your stomach, making it more vulnerable to stomach acid. That irritation is what leads to gastritis and, in some cases, stomach ulcers. So what symptoms should you watch for? A gnawing or burning pain in your upper abdomen, especially when your stomach is empty. Nausea or loss of appetite. Frequent burping or bloating. And sometimes, dark stools or unexplained fatigue, which could hint at bleeding ulcers. But here's the thing. Not everyone with H. pylori has symptoms. Some folks go years, even decades, without knowing it's there. That's why it can be so tricky. If your doctor suspects H. pylori, they'll probably start with some tests. The most common are a breath test, where you drink a special liquid and breathe into a bag. A stool test, which looks for the bacteria's proteins. Or, in some cases, an upper endoscopy with a biopsy, if your GI symptoms are significant, or you're over a certain age, or from a country with a high incidence of infection. And yes, H. pylori can increase your risk for certain conditions if left untreated, including ulcers and even stomach cancer. So it's worth taking seriously. The good news? It's treatable. Most people are prescribed what's called triple therapy: 2 antibiotics to kill the bacteria and a medication to reduce stomach acid, helping the stomach heal. It usually lasts about 10 to 14 days. But treatment isn't one size fits all. In some cases, doctors may recommend a 4-drug regimen known as quadruple therapy, or newer options that include different antibiotics or acid-lowering medications, like vonoprazan, also known by the brand name Voquezna. Whichever treatment regimen is advised, it is important to take every dose, even if you start feeling better early. Failing to do so can lead to antibiotic resistance and more difficulty eradicating the bacteria in the future. After you have completed treatment, it is best practice to be tested again to ensure eradication of the bacteria. This is most commonly done with the breath test a few weeks after completion of the treatment. So if you've been living with chronic stomach issues, don't ignore them. Ask your doctor about Helicobacter pylori. A simple test could give you answers and a clear path toward feeling better. And remember, stomach pain isn't just something you have to live with. There are answers, there is treatment, and you deserve to feel well,